Hi. Should I start, Bhageshri?
Yeah, wait a minute. Yes, you can start.
Yes, I will start. Aparna.
Sorry?
Yeah,
This-
Nepal, start now.
Yeah, Nipa. Yeah, okay. Sorry.
Hello everyone. President Aparna, all the district dignitaries present, all Inavil presidents and past presidents, secretaries, and my dear friends. A very good evening and a very warm welcome to all. Inavil Club of Pune Imperial, Inavil Club of Khadki, Inavil Club of Pune Downtown द्वारा आयोजित आज के वेबिनार मेनोपॉज फॉलआउट्स एंड रिजॉइसेस में मैं नीपा जोग आप सभी का तहे दिल से स्वागत करती हूँ. I welcome our today's speaker, renowned gynecologist Dr. Jyoti Agarwal. ज़्यादा वक्त ज़ाया न करते हुए मैं इनाविल क्लब ऑफ पुणे डाउनटाउन की प्रेसिडेंट अपर्णा प्रधान को मीटिंग शुरू करने के लिए आमंत्रित करती हूँ.
Thank you, Nipa. Meeting call to order.
Thank you, President Aparna. May I request President Bhageshri of Inavil Club of Pune Imperial to recite Inavil prayer?
Raise your hand. Instill in us, O Lord, the true meaning of friendship. Never let us forget that we are all thy children, notwithstanding the differences in our culture and creed. Endow us with a desire to serve our fellow men, remembering that we too often need help. Whenever or wherever the need for services arises, help us to be ready to serve, enduring to make our badge of inner will worthwhile, ensuring that we have not lived in vain.
Amen.
Thank you.
Thank you, President Bhageshri. हर नए काम की शुरुआत प्रभु के आशीर्वाद से होती है. तो चलिए दीपक प्रज्वलित करते हैं.
शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तु ते दीपज्योतिर्नमोऽस्तु ते शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः
Thank you, Past President Shobha, for that beautiful video. May I request President of Pune Downtown, Aparna Pradhan, to welcome our guests.
Thank you, Nipa. Good evening, President Bhageshri, President Anita, district dignitaries, all PDCs, President of other Innerville clubs, past presidents, secretaries, Innerville members, friends, and invited guests. I welcome you all for this enlightening talk on menopause, fallout, and rejoices by noted gynecologist Dr. Jyoti Agarwal. As they say, we all are aware that menopause in ladies sets in between the age of 45 to 55 years. Lot of hearsay things which leads to lot of confusion in many. But today on this platform, our doubts will be clarified by Dr. Jyoti Agarwal. She will guide us on how to tackle menopause in a positive way and how to enjoy period-free life. Thank you.
Thank you, President Aparna. May I request President of Inavil Club of Khadki, Kirti Kolhatkar to introduce our esteemed speaker, Dr. Jyoti Agarwal.
Unmute her. Unmute her. Unmute yourself, Kirti.
Yeah. Thank you so much. One slight correction. I am not the president of Innerville Club of Kharki. I am the ex officio in the EC team. Our president is unfortunately not well. That's why she's not able to come. And secretary had some other commitment. So on behalf of our club, I take this opportunity to introduce Dr. Jyoti Agrawal, uh, who has been a practicing obstetrician and gynecologist since 1999. After MBBS from SMC Jodhpur, she worked at SMS Hospital Jaipur, Apollo Hospital New Delhi, and AIMS New Delhi. She moved to Pune in 2000 and has adopted it as her home, except for her postgraduate studies at KJ Sumaya Medical College at Sion in 2002-2003. She has been practicing in Aundh, Baner, and Balewadi area all through. She is presently practicing as consultant gynecologist and laparoscopic surgeon at her practice in Baner, Pune, which was her dream project. She also renders consultation and fertility treatment at Jupiter Hospital and Umarji Hospital at Pune. Being a veteran in the field, she specializes in treating tubectomy, tubal ligation, no cut, no hole gynec surgeries, cervical cerclage, IVF fertility treatment, intrauterine insemination, hysterectomy, fibroid removal, and every issue related to reproductive system. She has acquired identification as a doctor with a flair for perfection, crystal clear surgical acumen, and rational treatment based on perfect diagnosis. A mother figure for patients and most dependable during an emergency and high risk situations. She is a staunch feminist and believes in empowering women through health. She also believes that women can bring about a dramatic change in the social situation in the country through acquiring knowledge and guidance about feminine health and thus pave road to healthy future generation. She is an excellent counselor and a passionate doctor. That was our today's speaker, Dr. Jyoti Agrawal, in brief. Thank you so much.
Thank you, Kirti, for that beautiful introduction. फ्रेंड्स, आज के वेबिनार का टॉपिक है मेनोपॉज, जिसके बारे में कभी हम सब ऐसे सोचते हैं कि हमें सब पता है और कभी कभी लगता है हमें कुछ भी नहीं पता। आइए उसी के बारे में सही जानकारी प्राप्त करते हैं हमारी आज की स्पीकर डॉक्टर ज्योति अग्रवाल से। ओवर टू यू ज्योति।
Hello everyone. Give me a second. I would like to start the screen sharing. Is my screen visible?
Yes.
Yeah, it started.
Yes.
PowerPoint presentation.
Hello Hello everyone, I'm Dr. Jyoti Agarwal here. Welcome to this discussion about a very important part of a woman's life, talking about the fallouts and rejoices of menopause. Am I audible to everyone?
Yes.
Yes.
Menopause is a very important part of a woman's life. It is the end of the menstrual cycle, and it is diagnosed after a lady has gone about 12 months without a menstrual period. It can happen any time in between the 40s or the 50s, sometimes reaching up to beyond 55 years of age. And it is a very natural biological process. Most likely, you will experience some irregularity in your periods before they end. It may also disrupt your sleep or your energy or affect the emotional health. Let's talk about what are the basic problems, the common issues which we women face when we are around the menopause, which is called the months or years which are leading up to the menopause. We know that is known as the perimenopausal age or the climacteric period. So it can be irregular periods. It can be resulting into very interrupted kind of a bleeding. It can happen resulting into intermenstrual bleedings or short cycles, or the cycles become extremely long. It can be dryness in the vagina, causing very uncomfortable feeling, itching, thinning, tingling. It can be hot flashes or cold flashes. It can be chills. It can be night sweats. Various systemic features called heavy night sweats can cause sudden sweating. It can be sleep problems. Some women might say that I used to sleep properly at 10:30 and wake up at 6 in the morning, but I'm no longer able to do that. I'm twisting and turning in the bed for several hours before I actually go to sleep. Or I keep waking up in the middle of the night, or I wake up very early in the morning, which is not my usual sleep pattern. Mood swings and mood changes, very commonly found, and usually people are talking about it like that, yeah, she's going through a perimenopausal phase and she's more irritable and she's not listening to us and she flares up so quickly. There can be depressive mood, poor memory, inability to concentrate, anxiety on very tiny things which the women used to handle very easily earlier. So these are all parts of the perimenopausal age. Weight gain happens, slowed metabolism is there. The basal metabolic rate becomes much lesser than what it was earlier. There is a change in the fat metabolism, so which is why the collection of fat happens more around the abdominal area, and people start feeling that, oh, I'm putting on weight, though I was not doing that earlier, but I'm putting it on very weird places which were not there earlier. Thinning of the hair and the skin, dryness of the skin, loss of the breast fullness. So women are very conscious about their shape, and they say that, okay, my breast has started becoming a little more loose. I can understand that they are sagging, there is wrinkling, the firmness is reducing, and also some psychological issues start developing, like dizziness and less interest in sexual activity, reduced libido. All these are parts of the menopausal transition, which women and in this age group particularly around 40 start developing. Other than these, there are joint pains, stiffness of the joints, which used to be very flexible earlier, backaches, and soreness of the joints, start developing knee pains, neck pains, and all these are a part of the perimenopausal age group, which we see here. So let's understand what brings them about. What is the physiology of menopause? So skipping periods during perimenopause is common and expected. Often the menstrual periods they skip for a month and then they will return, or they will skip for several months and then start on a monthly cycle again for a few months. They also tend to happen on shorter cycles, very closely paced. But despite all these changes, pregnancy is possible in this age group. And if a lady has skipped a period but isn't sure that she has completely reached the menopause, she should consider a pregnancy test. So, what are the hormones responsible here? Let's talk about them. Perimenopause age The estrogen hormone and the progesterone hormone are the two main hormones which are functioning on our reproductive system. So ovaries are running out of eggs in the perimenopausal age. As a result, the production of estrogen slows down. As the eggs are less, the ovulation becomes irregular. As you can see, can someone see the pointer here which I'm pointing at? Hello?
Yes, we can see.
You can see the pointer. So here
Yeah.
that I'm pointing out at the ovaries. So here the number of eggs are reducing. As a result, the frequency of ovulation reduces. As a result, the number of periods also reduce. And because the ovulation does not occur, the progesterone is not produced. Progesterone is the main action hormone functioning on the uterine line. So the thickening of the uterine line also becomes patchy. At some places it will be thick, and some places it will be very thin, resulting into irregular periods. As soon as the woman reaches menopause, very little estrogen is released. So the ovulation does not occur. And as a result, there is no progesterone. So since there is no progesterone, the lining of the uterus does not thicken at all, and resulting into complete cessation of the period cycle. So this is the basic physiology which I've tried to explain, mainly considering two main hormones, estrogen and progesterone, which are working in our body. So the symptoms which cause changes in the menstruation are very different for every woman. Some of the women are very fortunate to have regular cycles, evenly spaced, and then they stop having the menstruation. And some have a very difficult time of life in this perimenopausal or the climacteric phase, when the periods become extremely heavy, or they are very short paced, with resulting into a lot of discomfort, pain, cramping, heavy flow, clots in between periods, bleedings, and resulting into anemia, weakness, and lot of other problems which they might have. There are many effective lifestyle changes and hormone therapy which we want to use during this time. So let's talk about some particularly disturbing features that the ladies experience during the menopause. Cool, hot flashes. So what are exactly cool, hot flashes? The vasomotor flash is described as a feeling of warmth or heat that begins from the umbilical area and moves upwards towards the head, followed by sweating of the head and the upper body. It is the most common symptom, affecting about 75% of the women. Very unpredictable in onset. It can come any time of the day, may last for a few minutes, and repeating every few hours in a day, or maybe once in a few days. It may cause embarrassment, discomfort. If the lady is sleeping, it will disturb the sleep. Emotional instability can happen. So what helps in these flashes? So we normally recommend that a woman should dress in layers, like wear 2-3 layers of thin clothes. So when she's feeling hot, she can take off a layer of clothes and start feeling a little more comfortable. Keep a glass of cool water handy. Use cooler spaces. Open up windows and doors. Gardens are best place. Okay. So we try to pinpoint what triggers those hot flashes. So there can be some of the triggers which women experience. For many women, triggers may include hot beverages, caffeine, spicy foods, alcohol. Stress can also trigger the hot flashes. Hot weather, even a warm room.
Excuse me, Jyoti.
Yes,
Sorry to interrupt you. Can you explain little bit in Hindi also?
yes, definitely.
Thank you.
हॉट फ्लैशेस जहां हम बात कर रहे हैं उसमें थोड़ा ज़्यादा गर्मी, अचानक से पसीना आना, ये सब आपको फील होगा। ऐसा लगता है जैसे अचानक से शरीर में गर्मी बढ़ने लगी, सर में पसीना आने लगा, अपर बॉडी में ज़्यादा पसीना आता है। तो उसकी वजह से थोड़ी सी तकलीफ होने लगती है, नींद की डिस्टर्बेंस होती है। तो उसमें हम बताए हम जो चीज़ें मदद करती हैं वो ये है कि आप 2-3 लेयर्स में पतले कपड़े पहने और उनको जरूरत के हिसाब से आप निकाल सकते हैं। थोड़ा ठंडा पानी साथ में रखें। कुछ चीजें होती हैं जो इस चीज को ट्रिगर कर सकती हैं, इन हॉट फ्लैशेस को बढ़ा सकती हैं या सडनली डेवलप हो सकते हैं वो, जैसे कैफीन के यूज से या ज्यादा गर्म लिक्विड्स के यूज से, बहुत तीखा खाना, अल्कोहल, या बहुत ज्यादा स्ट्रेस अगर है या बहुत ज्यादा गर्मी है, तो इन सब चीजों की वजह से हॉट फ्लैशेस भी ट्रिगर हो सकते हैं। वजाइनल डिस्कम्फर्ट, जो ये सब काफ़ी कॉमन प्रॉब्लम है जिसकी वजह से इस एज पे लेडीज़ को बहुत ज़्यादा तकलीफ होती है। उस केस में वजाइना का डिस्कम्फर्ट होता है, इरिटेशन होता है, बर्निंग, इचिंग तकलीफ होती है। उस केस में हम लोग ये रिकमेंड करते हैं कि कुछ ओवर द काउंटर मेडिसिन जैसे वाटर बेस्ड वेजाइनल लुब्रिकेंट्स होते हैं, ये एस्ट्रोलाइड केवाई जेली या सिलिकॉन बेस्ड लुब्रिकेंट्स के नाम से दे आर अवेलेबल, मॉइस्चराइजर्स आर अवेलेबल लाइक रिप्लीन्स। ये प्रोडक्ट्स ओवर द काउंटर है और ये यूज किए जा सकते हैं, विच विल रिड्यूस द इचिंग, ड्राइनेस एंड विच विल गिव यू लिटिल कंफर्ट। इट डजंट कंप्लीटली गो अवे, लेकिन जो प्रोडक्ट्स ग्लिसरीन वाले हैं वो अवॉइड करना चाहिए क्योंकि उससे बर्निंग या इरिटेशन हो सकती है। Staying sexually active definitely helps to increase the blood flow in the vagina. तो वो एक बहुत important recommendation. Usually women when we are reaching around 45, they would say कि अच्छा ठीक है, it's okay if it doesn't happen. But I guess it is a very, very important part of our physiology. And it should be taken with interest. और जहाँ ज़्यादा तकलीफ है वहाँ पे हार्मोन रिप्लेसमेंट थेरेपी इन द फॉर्म ऑफ एस्ट्रोजन प्रोजेस्टेरोन थेरेपी can be used to improve the libido and improve the health of the vagina. To get enough sleep, it's very, very important. Around this time, many times people are disturbed because of their symptoms, because of their work-life balances, and they are not able to sleep enough. लेकिन इस वक्त पे नींद का पूरा होना बेसल मेटाबॉलिक रेट यानी हमारी बॉडी के मेटाबॉलिज्म के लिए बहुत इंपॉर्टेंट है। कैफीन यूजुअली वी शुड बी अवॉइडिंग which makes it difficult to sleep. नींद लेना कैफीन के साथ बहुत मुश्किल है and people usually have coffee when they want to stay up. So drinking alcohol and caffeine can disturb sleep. Exercising usually during the day is always recommended. अगर रात के समय की गई एक्सरसाइज वो आपको इतना ज़्यादा जगा देगी, इतना एक्टिव कर देगी कि फिर नींद आनी बहुत मुश्किल हो जाएगी. So it has to be done during the day. And if hot flushes disturb the sleep, then we need to find out what is triggering them and take some support for them. Relaxation techniques are very, very important. Stress is a part of our life. And along with the symptoms which are troubling us, ये जो परेशानियां मेनोपॉज के आसपास आ रही हैं, उसके साथ साथ हमें नींद की परेशानी, weight की problem, so there is too much which is going in our minds. Relaxation is very important. Techniques with like deep breathing, paced breathing, imagery guided imagery, massage, progressive muscle relaxation, they definitely help with menopausal symptoms. तो अगर आपने पहले कभी मसाज नहीं कराया है तो then this is the time when you should get it done. You should relax, meditate, rejuvenate, and positive thinking, extremely important at this time of life. You can find several books, CDs, online offerings on very different relaxation techniques which can be definitely used. We need to strengthen your pelvic floor. Very, very important. क्योंकि urinary incontinence, increased urgency and frequency of urine, बार बार वॉशरूम जाने की इच्छा होना और उसके लिए रुक ना सकना, ये एक परेशानी बहुत ज़्यादा इस उम्र में हमें अराउंड 45 to 55 बहुत ज़्यादा फील होती है. तो दैट इज द एक्शन ऑफ योर पेल्विक फ्लोर मसल्स. जिनके पेल्विक फ्लोर मसल्स स्ट्रॉन्ग है उनको ये परेशानी बहुत कम होगी. So various pelvic floor muscle exercises like Kegel exercises can definitely improve the forms of urinary incontinence and urgency. So as we are talking about the various symptoms, and we also know at any age group, be it the perimenopausal age group or postmenopausal or even in a young girl, exercise is very, very important. Regular daily exercise, regular physical activity on most of the days would help to protect against heart disease, diabetes, osteoporosis and other conditions which are associated with aging. And अगर आपका पुराना 8-10 साल से आप रेगुलर एक्सरसाइज कर रहे हैं तो ये परेशानियां, ये जो नॉर्मल मेटाबॉलिक डिजीजेज विच आर वेरी कॉमनली फाउंड, जो आज के ज़माने में हर घर में मिल जाएंगी, वो बहुत कम हो जाती हैं, उनके चांसेस बहुत कम हो जाते हैं. हार्ट डिजीज और ऑस्टियोपोरोसिस मेनोपॉज के साथ में ज़्यादा होती हैं. because of the hormone changes which are going in our body. So along with brisk walk, weight training, progressive resistance training are other very, very useful methods which strengthen the muscles and the bones. At this age, many a time we feel that the fractures are very common and we should avoid the fractures by strengthening our bones. Having a fall, having an injury is not in anyone's hand, but we can prepare our body for any such event. So besides sleep, besides regular exercise, diet is very, very important. To eat a balanced diet. As the metabolism is slightly slower, we need to reduce the calorie intake by 400 to 600 calories. Means जैसा कि हमारे यहाँ कहावत है कम खाना और कम खाना, राइट? तो खाना जिसमें कार्ब्स कम हो, 400 to 600 कैलोरीज डेफिनेटली उसका इंटेक कम होना चाहिए क्योंकि मेटाबॉलिज्म ऑलरेडी स्लो है, तो वेट गेन के चांसेस ज़्यादा हैं. what variety of fruits और vegetables, whole grains, ये हमारी डाइट का डेफिनेटली एक हिस्सा होना चाहिए. सैचुरेटेड फैट्स, ऑयल्स और शुगर्स कम करने से ऑटोमेटिकली कैलोरी इंटेक कम हो जाएगी. विटामिन्स एंड मिनरल्स विल इम्प्रूव द मेनोपॉजल सिम्टम्स. ये देखा गया है कि जिनकी डाइट में ज़्यादा विटामिन्स हैं, ज़्यादा मिनरल्स हैं, उनका मेनोपॉजल सिम्टम्स लेस सीवियर हैं. जो नॉनवेज खाते हैं दे कैन हैव चिकन एंड फिश. एशियन जो पॉपुलेशन है उसमें जो लेडीज हैं उनको मेनोपॉजल सिम्टम्स, क्लिमेक्टेरिक सिम्टम्स कम देखे गए हैं एंड द रीजन इज अ सोया प्रोटीन बेस्ड डाइट. हमारे डाइट में सोया प्रोटीन इज अ वेरी इंटीग्रल पार्ट और increased intake of soya protein has been found to help the symptoms around the perimenopausal age. We can discuss with your doctor whether you need a calcium, vitamin D, magnesium supplements. Normally, doctors recommend करते हैं कि calcium supplement around 1200 to 1500 milligram रोज लेना चाहिए. Even though women are having adequate amount of milk and curd, still we recommend क्योंकि body में vitamin D और calcium इन सबका absorption जो intestines हैं उनका काम थोड़ा स्लो हो जाता है, तो जितना इंटेक है उतना हमारी बॉडी को मिलता नहीं, इसलिए थोड़ा एक्स्ट्रा सप्लीमेंट देना ठीक रहता है. अराउंड 45 years of age everyone should start having calcium. Normally हम recommend करते हैं 1500 milligrams in 3 divided doses is the calcium that everyone should take. And the chewable calcium is best. Someone has raised a hand. Is there a question? Hello?
Dr. Jyoti, we will do question answer at the end,
Yes.
once the session is over.
Someone has raised a hand, so I just wanted to know what is the issue, but it's okay. Can I go ahead?
Yes, please.
Right. So smoking, yes, very, very rampant in our modern society. We can see young girls with a cigarette in their hand. It was not a common.
Jyoti, can I interrupt for a second? Somebody is saying that they can't hear you. You'll have to be little louder.
Okay. Okay. Am I audible now?
Yes.
Yes. Okay. So we are talking about smoking right now. It is common in our society nowadays. We can see young girls with smoke in their hand around the corners, on joints, in pubs and all. It is common in our society nowadays. It was not there at all in the previous generation. Smoking definitely increases your risk of heart disease, stroke, and osteoporosis, even cancer, and a range of other health problems. It will also increase the hot flashes and bring on an earlier menopause, which means smoking, the free radicals जो कि सिगरेट के साथ निकलते हैं वो हमारी ओवरीज को डैमेज करते हैं और जल्दी menopause, having a problem with the fertility and having more symptoms during the menopause, early menopause. These are the problems which can happen. Even in the modern society, along with the modern society, we can see the smoking very common in villages. We can see, you can look at the picture. This is the woman of an Indian village who is smoking using bidi. Very, very common. Bidi and hookah are very common in the women of the village, of Indian villages. And these are the reasons why people are getting more symptoms even in villages, although they are more active, more sun exposure, and they have a very strong physical activity background. Still, they are developing early menopause and maximum menopause symptoms. So smoke is definitely a no-no. So let's talk about the psychological issues which the women can have. So talk and discuss. We women have been the pillars of our home. Everything, every problem comes to us, and we have to find solutions. But this is the time when we need help. We need to talk and discuss. Perimenopausal time is a time when you have so many issues which are developing inside you. So talk to your family members, talk to your friends, talk to a doctor. Even when at any point of time when you have problems with your body, how your body is responding, when you are feeling you're not able to understand why I'm reacting so badly to a particular situation. If you're depressed, you are stressed out, you're anxious, talk to your family members, talk to your friends. Inner wheel in general is a big family. It's such a big group of friends. We can definitely use that whenever we are feeling depressed. So mood disturbances are very common in the menopausal transition phase, and it really helps to talk, to express, and find solutions, give support to each other, cooperate. It may the disturbances are related to estrogen deficiency or excessive progesterone dampening, which is the positive effect of estrogen. So the progesterone dampens the effect of the estrogen. So estrogen is the positive hormone in our body, and since its production is reduced, उसका बनना estrogen का कम हो जाता है क्योंकि ओवरी में जो एग्स हैं वो कम है. इस वजह से प्रोजेस्ट्रॉन जो है वो डैम्पन कर देता है estrogen के इफेक्ट को. इसके अलावा अदर देन द हॉर्मोन्स सर्कमस्टेंसेस भी प्रॉब्लम्स क्रिएट कर सकते हैं. ये एक स्टेज है जब बच्चे घर से बाहर जा रहे हैं या फैमिली में कुछ नए इश्यूज हैं या कोविड के चलते हमने कई जगह फाइनेंशियल प्रॉब्लम्स भी देखी हैं जहाँ पे लेडीज बीमार या हस्बैंड्स बीमार हैं या कुछ अदर हार्डशिप्स ऑफ द लाइफ चल रहे हैं रिलेटेड टू द फैमिली एंड फाइनेंशियल इश्यूज. ये सब भी मूड्स को डिप्रेस करते हैं, इरिटेशन प्रोड्यूस करते हैं, एंजाइटी प्रोड्यूस करते हैं, स्ट्रेस प्रोड्यूस करते हैं. और इन सब चीज़ों के साथ साथ अगर मेनोपॉज के सिम्टम्स चल रहे हैं, इट्स very very bad for the lady. She is going through a very bad phase in combination with the stress which is regenerated from outside as well as inside. So talk and discuss, take psychological help if required, but there is no harm and there is no shame in doing that. We need to express our problems, not try to tackle them on our own. So life is changing. We need to stop avoiding the comparison between us today and us previously. Comparing your current reality to how I used to be is not healthy, definitely not healthy. How I am looking today, how I used to look 5 years back. Yes, we look at the pictures and we find that, oh yes, I've changed a lot, my physically as well as mentally, as well as, my abilities to capacities to handle stress and capacities to handle the problems in the life is definitely changing. And it's okay. We have to accept it with open arms. We have to be positive about it. And we have to understand when we need help and when we need to ask for help, because whenever we women need help, we don't ask for help, we hesitate. So we have to accept the changes that are going on and we have to accept the reality. So we have to recognize that the journey is unique. Every woman has a different and a unique life, different changes which are happening to her life at all different stages of life. We have to be open to the possibility that you may emerge healthier, happier, energized, and more confident and content with the road ahead. So, whenever we look back, we see what we have achieved and feel happy and full of energy for what we are going to achieve. We have to assess the current lifestyle जो आज हम हमारी जिंदगी का दिनचर्या है, जो हमारी हमें उसको असेस करना है, समझना है कि हमारी ईटिंग हैबिट्स क्या हैं, हमारी फिजिकल एक्टिविटी क्या है, हमारा नींद, हमारा स्ट्रेस और हमारा कॉन्शियस कमिटमेंट होना चाहिए उन एक्शंस की तरफ जो कि साइंस ने हमें बताए हैं हमारे लिए जरूरी है. We have to be very have a conscious commitment to the actions which are science and research have proven will be of benefit in the perimenopausal age group. You have to find a doctor who will really listen and is interested in helping to support you during this stage of life. Just writing the medication or doing the tests is not the solution. We have to find out where is the emotional link. Where is exactly the problem originating from? Is it just the hormone disturbance or there is something else also going on? तो उन दोनों प्रॉब्लम्स को लिंक करके और सॉल्यूशन निकालना है. We have to build and strengthen our support system. There are ladies who do who take up all the responsibilities on their own shoulders, and they are running from pillar to post for each and everything since morning till late in the night. So that is not what we should be doing at this age. We have to build up a good support system of household help, family, friends. Ask for help from your husband and your kids. They are grown up now. They can support you in smaller things of the life. They can support you in taking care of yourself as well as the house and your work. So good work-life balance with a beautiful support system and friendship is the demand of the time. Explore integrative modalities like acupuncture, mindfulness, meditation, practicing gratitude, yoga, herbal medicine, and massage. Yes, so these should be integrated in the life where to make it more wholesome, more relaxing, and more uh, good for the emotional instability which is going on. So all these factors can definitely help. These are a few medication I would like to talk about which are available. Hormone replacement therapy is the mainstay of treatment. जहाँ पे ज़्यादा परेशानी है, ज़्यादा प्रॉब्लम्स हो रहे हैं पीरियड्स को लेके या वजाइनल ड्राइनेस को लेके या साइकोलॉजिकल इश्यूज हो रहे हैं, वहाँ पे हार्मोन रिप्लेसमेंट थेरेपी कॉमनली नोन एज HRT ईस्ट्रोजन और प्रोजेस्टेरोन सप्लीमेंट्स के साथ में दिए जा सकते हैं प्रॉपर डोसेज में. Thinning of the hair, is there a medicine? Yes, we have. Unwanted hair growth, there is a medicine. Yes. Depression, anxiety, and hot flushes. Usually, these are controlled by psychological counseling, help, exercise, diet, and sleep. But still, अगर उससे नहीं आराम आता है, तो then there are selective serotonin receptor inhibitors जो हम यूज कर सकते हैं कुछ टाइम के लिए. Vaginal dryness के लिए जैसा मैंने पहले बताया, moisturizers and lubricants can be used. Because of the urinary incontinence and urgency, urinary tract infections are very common at this age. Because of the dryness and increased risk for the infections, antibiotics can be definitely used in recurrent cases of urinary tract infections. Insomnia, as I said, sleep problems are very commonly happening. So sedatives can sometimes be taken. We normally don't recommend, लेकिन कुछ doses लिए जा सकते हैं. As I said, osteoporosis, yes, our bone stiffness and the soreness of bones, backaches, ये problems काफ़ी common हो जाते हैं इस age group पे. Normally उसको हम diet और exercise के through handle करते हैं, but there are some medicines which can be given in recommended doses. Alendronate बहुत commonly prescribe किया जाता है, 5 milligram per day to prevent the development of osteoporosis, which means बोन्स का फॉर्मेशन अंदर से कम होने लगता है और बोन्स कमजोर और पतले होने लगते हैं, जिसकी वजह से हिस्ट्री ऑफ फॉल इस एज ग्रुप पे हमें बहुत ज्यादा दिखाई देता है. हमें नॉर्मल वे में जिस तरह का हमारा सेटअप है उसमें कुछ चेंजेस करने चाहिए टू अवॉइड एनी काइंड ऑफ फॉल्स. देखा जाता है जैसे रात में अगर लेडीज उठती हैं तो देन दे शुड बी अवेयर कि हमारा बेड साइड लैम्प ऑन हो. बाथरूम तक जाने का रास्ता जो है वो बिल्कुल क्लियर होना चाहिए, रास्ते में फर्नीचर वगैरह बाहर ना हो. इफ रिक्वायर्ड अ वॉकिंग स्टिक कैन बी यूज्ड बाय women of older age group to avoid all kinds of falls. Avoiding falls is important because repair and recovery is slow at this age. We definitely recommend vitamin D supplements. Normally 400 to 800 international units per day दिए जाते हैं, which are adequate along with 20 minutes of regular sunshine exposure. It is very important. Daily 20 minutes के लिए हाथ पाँव पे, बैक पे, जहाँ भी पॉसिबल हो सन का एक्सपोजर बहुत ज़रूरी है. नॉर्मली मॉर्निंग 7:30 से आफ्टरनून 12:30 के टाइम का 20 मिनट्स का सन एक्सपोजर, उससे हमें एनफ विटामिन डी मिल जाता है, जो कि हमारी ज़रूरतों के साथ के लिए काफ़ी है। अगर हम थोड़ा विटामिन डी सप्लीमेंट लेते हैं तो ये जो 20 मिनट्स का सन एक्सपोजर है, जिसमें हमारी स्किन विटामिन डी बनाती है, ये हमारी बोन्स के लिए काफ़ी पर्याप्त है, इट्स एनफ। And at that time you can be reading a newspaper, you can be going for a walk, आप breakfast कर रहे हैं या phone पे बात कर रहे हैं, use that time to get yourself exposed to the sun. Because of the COVID situation, lot of the women are inside at that time, so find a spot in your balcony, in your window, bedroom windows, or somewhere where you can sit and get exposed. ये एक बात बहुत important है बताना यहाँ पे कि जो धूप खिड़की के कांच से आती है वो विटामिन डी नहीं देगी, इसलिए विंडो का जो कांच है वो ओपन करके रखिए और डायरेक्ट धूप अपने चेहरे पे और हाथ पांव पे लीजिए। जो कांच के थ्रू धूप आएगी उससे आपको विटामिन डी प्रोडक्शन बॉडी में नहीं हो सकती। ऑलराइट, सो इस विटामिन डी के अलावा एक है विटामिन ई, विच इज अ वेरी पावरफुल एंटीऑक्सीडेंट, और वो हम जरूर बोलते हैं इस समय लेने के लिए। देयर इज नो हार्म इन टेकिंग दैट विटामिन लाइफ लॉन्ग, स्टार्टिंग फ्रॉम 40 years of age। 200 to 400 इंटरनेशनल यूनिट्स पर डे के हिसाब से विटामिन ई के कैप्सूल्स अवेलेबल हैं जो आपको लेने चाहिए। उसकी वजह से मूड के चेंजेस जो हैं उनमें बहुत आराम मिलता है, स्किन की इलास्टिसिटी इंप्रूव होती है। यू वांट दैट ग्लो बैक, यूज विटामिन ई। You want the glow which you had during your around the 30s. So use a lot of vitamin E, sorry, and use application of vitamin E on the skin is also very, very useful along with the intake of vitamin E. When to see a doctor? So I am talking about things जो हम अपने आप कर सकते हैं, अपना लाइफस्टाइल चेंज करना, अपना डाइट चेंज करना। लेकिन फिर भी कई सिचुएशंस ऐसी हैं जहाँ पे आपको डॉक्टर की जरूरत पड़ेगी। आफ्टर द एज ऑफ 45 रेगुलर डॉक्टर विजिट्स डेफिनेटली जरूरी हैं फॉर प्रिवेंटिव हेल्थ केयर एंड मेडिकल कंसर्न्स। कुछ ऐसी चीजें जो आप अपने आप ठीक नहीं कर सकते, उसके लिए जाना है। और रेगुलर एनुअल चेकअप्स रिगार्डिंग द ब्लड टेस्ट्स एंड बेसिक एग्जामिनेशन जैसे मैमोग्राफी, बोन मैरो डेंसिटी, ट्राइग्लिसराइड स्क्रीनिंग, कोलोनोस्कोपी, ये सभी टेस्ट रेकमेंड किए जाते हैं जैसे रिक्वायरमेंट हो। नॉट एवरीवन हैज टू गो थ्रू दिस, बट बोन मैरो डेंसिटी and triglyceride screening along with the blood tests which include basic hemoglobin, sugar, basic urine test, ये सभी हर साल करवाए जाने चाहिए। Other tests might also be recommended which include thyroid test if suggested by the history and your breast and pelvic examination. If a woman has reached menopause but after a few years or maybe a year or two and she starts bleeding again, that is a cause of concern. There should be absolutely no bleeding if you have reached menopause, and you need to seek medical advice. And there is no problem and there is no shame in, or no discomfort should not be there definitely in seeking the medical help. There is one more very important aspect known as self-breast examination. Every woman should do the breast examination on her own every month. It is very simple and it can be done at home. If the lady is still bleeding, having periods, maybe every month or every 2 or 3 months, once she finishes the period, place the palm of the hand on all the 4 portions of the breast and palpate gently to find out if there is any lump, कोई भी गांठ या कुछ भी ऐसा जो अलग है। आपकी एक्सिला यानी बगलों में आप अपनी फिंगर्स डाल के चेक कर सकते हैं कि वहां पे कुछ अलग है या कुछ गांठ फील हो रहा है क्या। स्किन का चेंज होना यानी कि कलर चेंज होना या निपल्स के आसपास की स्किन में कुछ अगर बदलाव आ रहा है तो ये डेफिनेटली एरिया ऑफ कंसर्न है और उस समय अपने डॉक्टर से जरूर बात कीजिए। सो इट्स अ वेरी सिंपल method, but it should be always followed by all the women reaching around 45 every month, whether they have reached menopause or not, irrespective of the period cycle. Menopause is a great time for deep personal reflection, where we have come all the way in this life, what we have achieved, and what we are planning to achieve. It is the time to take a step back and look into what is happening around us and what are our ambitions, what are our achievements, and what exactly do I want from myself. So it is called deep personal reflection, which is the time, menopause is the time when we should be doing that. Some of the ladies, for the first time in their life, you might be an empty nester. Means the kids are big, they have gone to their colleges, husband is busy with some work, you have a limited timeline of work. So that is the time when you have to look at what I want. This question was never asked probably in the last 45 years. कि आप क्या चाहती हैं, आप क्या करना चाहती हैं, क्या आप पेंटिंग करना चाहती हैं, क्या आप डांस सीखना चाहती हैं, क्या आप सिंगिंग करना चाहती हैं, क्या आप कुछ अलग हॉबी फॉलो करना चाहती हैं. लेकिन कभी टाइम ही नहीं मिला, कभी मौका ही नहीं मिला. So you don't have to run from one activity to another because the children are older. So you find time for yourself now. You have to take the time to invest in yourself. Excuse me, I'll just have some water and come back. Sorry for interruption. Am I audible? Hello?
Yes, yes.
Yes.
So we have to take the time to invest in ourselves, start thinking about ourselves, and begin as early as you can to make small adjustments to your eating habits, your fitness, your work-life balance, emotional and mental health. You don't have to wait to reach the menopause to start this. To start this, several years before that. The preparation has to start before that. We we have to welcome the menopause and not be afraid of it. So there was a survey, and the survey respondents have written they learn to have a greater awareness of how all the stuff that happened in their lives comes to a head. Matlab, when in the menopausal age, they start reflecting. उनको ये पता चलने लगता है कि जो कुछ उनके लाइफ में हुआ है वो सब एक रीजन के लिए था. They are doing a reflection on what all that was. वो क्या था, जो कुछ हुआ क्या वो सही था. Are they going to put up with that now? क्या वो उसको अभी भी टॉलरेट करेंगी? And what they will change, और अगर नहीं करेंगी तो क्या बदलेंगी? And then they start taking care of themselves and to not worry about taking care of others. So a survey for women in this age group results into this kind of reflection and conclusion that women are getting aware and they are taking it up positively and they are happy about reaching the time when they don't have to worry about this monthly problem and they're welcoming the openness, relaxation, and the responsibilities that are happening at this. So ladies, friends, colleagues, rock my menopause is what I would like to tell you all. You have to rock your menopause, welcome it, be happy about it. It's a big phase, it's a big event in our life. We have to welcome it with open arms. Thank you so much, my dear friends, Inner Wheel Club members, president and members of IWC Kharki. IWC Pune Imperial, IWC Pune Downtown, and all the dear guests for having me here and listening with so much of patience. Thank you so much.
Questions? Any questions? Dr. Jyoti, Shobha, you start.
Yeah.
So you actually.
डॉक्टर ज्योति वंडरफुल इंफॉर्मेशन एंड बहुत सारी चीज़ें समझ में आएंगी एंड एक चीज समझ में आई कि 400 to 600 कैलोरीज कम खाना है. थोड़ा दुख हो गया बट वी विल
मुझे सबसे ज्यादा हुआ.
तो वी विल फॉलो इट. वो पता नहीं था, अभी समझ में आया कि कहाँ से क्यों साइज बढ़ रहा है. सो थैंक यू एंड वो इट स्टेड विथ मी. Now there are some interesting questions. एक बहुत ही सुंदर अच्छा question पूछा है. I think लाते. He wants to know, do men suffer hot flashes?
Oh, because estrogen is not there in men in general. Very little.
Oh, very lucky.
Very little. And estrogen is the feminine hormone. We have loads of estrogen, and the quantity of estrogen suddenly falls around the perimenopausal age, which doesn't happen in men. So they don't have these kind of things. But yes, around the age of 50, they also start feeling the stress of their work. The psychological issues can definitely happen with men.
बट हमारा इतना प्रॉब्लम नहीं होता है उनको. दैट्स व्हाट आई
नो.
Okay. Dr. Jyoti, there are many questions here. Okay. The next question is from someone, the name is not there. It says sugar cravings have increased. How do you reduce it?
So sugar cravings are there with the changes in the metabolism. Because the absorption has reduced. एज के हिसाब से इंटेस्टाइन्स का absorptive capacity कम हो जाता है, so the actual amount of nutrients जितना मिलना चाहिए उतना नहीं मिलता है. So to counter the sugar cravings, step up the exercise. You should increase the exercise level.
Okay.
You can eat some sweets per day, जैसे कि हमारी dear होती हैं. So you can do that, but you need to step up on your exercise level.
Okay.
Thank you.
Another question is there. This is Sudeepa Gautam. She is asking, Dr. Jyoti, kindly let us know if there is any good tablet for vitamin E that can be taken.
Yes, Evion tablets, capsule Evion, very easily available in the market. Evion capsules in the dose of 400 or 600 international units per capsule, which can be very easily taken.
Thank you. There is another question from again Sudipta. She's asking if you can recommend any precautions to be taken in food, exercise, or exercise for menopause.
Most important precautions we should be taking was during the menopause is to avoid any exercise which is jerky or can cause a sudden fall. So whenever you start exercising, you have to take it slow. Build it up according to the capacity of your body. If you have never exercised before, pick up those exercises which are easy to perform and will slowly mold and improve the flexibility of joints rather than immediately running to the gym and starting heavy weightlifting. So that is the golden rule that has to be followed always, that you start slow and slowly build up your capacity to exercise and then up the tempo.
Okay, another question is, that's very interesting. Okay, do the men too undergo menopause?
Yeah, they do. In a way, it's not very, very visible because there is no obvious symptom which suddenly stops happening in their body. But yes, they also reach around 50 to 55. They would have sudden changes in their psychology, their capacities, their exercise and stress bearing level. All this suddenly changes, and they are also aging just like us. But it is slower process. It is not very obvious, and it happens at a much later stage than it happens for women.
Thank you. Next question is from Pami Singh. She's saying, she's asking how many months it takes menopause to completely stop.
This is my question also.
So,
Same
Okay.
question.
menopause can start for any time between 40 to 55. So it's a huge range. And normally, family history plays a role a women to decide at what time she will actually have a menopause. So talk to your
No,
mother. Find out what age she actually had menopause. So
Dr.
that
Jyoti, like I got at 2 years back, 1.5 year back. Okay, my mother also had been the same age when she got her menopause.
yes,
Now the problem is that my hot flashes are still going on. It's been long, it's more than 1.5 year,
yes,
but it's still going on.
yes.
So what can we do about it?
So as I said, hot flashes,
Yes, hot flashes.
yes. So that they are very uncomfortable. We talked about them at length in this session. Yes. So there are some measures which I talked about when we were discussing hot flashes in this session, that you need to be in open spaces. You need to have your control over your diet. There are factors which might trigger the hot flashes. You need to find out what is the trigger for you. Why is it increasing and how we can reduce that trigger. And we need to wear layered clothing and keep cold water around you most of the times of the day. And you can take hormone replacement therapy if they are really troubling you. They will go on. In some women, they are for a longer duration, and in some women, they are for a shorter duration. But most of the women have these problems. And in your case, I would recommend that you, if you are really, really disturbed by it, you can seek medical help for this.
Okay, thank you. Next question is from Sunanda. She's asking, women above 65 also take vitamin E and calcium.
Women above 65, sorry.
And there is another question I want to ask. This I'm just adding to this question. See, I also heard when you take all these vitamins, actually body itna absorb nahi karti hai. Is it true? Ki only 10-20%? Or does it depend on the type of tablets we take? So please elaborate on that.
Yeah, there are tablets which are more body friendly, as you can say. So, for example, I was talking about calcium. So, we say chewable calcium is better than the calcium that is swallowed in. Calcium carbonate is better because and chewable calcium tablets need to be taken before food, and they are better absorbed. But just as I mentioned, with age, the digestive system starts becoming weak, and the absorption of vitamins and minerals is not that much as what it used to be. So even though we are taking enough quantity in food, it doesn't reach our bones or our other body parts where vitamins and minerals are needed. So hence the need of supplements. When we are taking supplements, not necessarily whatever quantity there in the supplement will be absorbed in our body, but yes, whatever our quantity will be absorbed will definitely help to maintain the levels where they should be.
Yes, Archana, do you want to ask one question? Archana, yes. Unmute yourself. Unmute yourself, Archana. You can't? Chal.
Hello.
Okay, doctor, I just want to ask one question that how much time should we sit in the sun to get vitamin D?
20
So,
minutes
what
of,
time? Like, what
yes,
is the exact right time?
Morning 7:30 to afternoon 12:30 is the best time for sun exposure, and 20 minutes per day is definitely minimum requirement.
So that is sufficient if we sit every day, or it is like particular days we have to sit, like
No,
how
all
many days?
days, 365 days, whenever the sun is available, you should use that. We are such a sun abundant country, but
Yeah.
unfortunately, 90% of the people are inside, and we are eating vitamin D tablets where when we should be sitting out and exposing our body to sun.
Yeah. Okay. Thank you so much.
Last one more question. That's my question. Does these supplements they help to help in increasing the weight?
When we
Because
are
with vitamin E, which I was taking, Avion, I felt that I have gained so much of weight. There are certain, must be certain other reasons also, but I think after starting that tablet, I have gained weight. That's why I wanted to ask you about it.
vitamin E tablet does not cause any weight gain. Calcium tablets, B complex, vitamin D do not
Okay.
cause weight gain. Probably it was some other things in the diet, or the basal metabolic rate fall, or lack of activity, or sleep disturbances, which are affecting the weight.
Lack of activities, though, I can't say that. I'm very active. I go to gym also. I do yoga every day. Lack of activity, I can't say. Diet is also my very controlled diet. I don't know which triggered that. Maybe I was taking that powdered calcium also, Colaflex. I
Okay.
don't know. With that also, I had knee problem. So I've gained weight.
Okay.
Yes.
See, as
Yeah.
I said, with age, the weight gain is normal and naturally happening because the body's metabolism is slowing down, even though you are doing whatever you were doing 5 years back.
That's right.
Yeah.
There is a weight gain happening because there is the distribution of fat in the body changes. It starts collecting on the tummy. Even though you're eating healthy and you're doing that exercise which you used to do earlier, with the same exercise, the weight gain will keep on happening.
Okay.
Yes, because the body's metabolism has slowed down. With it. What is the
Hello.
solution?
May I
You have
may
to
I
increase
ask one
the
question,
level
please?
and again make
Yes,
it
Pruchi.
a diet.
Yes, Pruchi.
This is not menopause related, but I just want to ask how good is Shelcal as a this thing, calcium tablet, Shelcal?
I would definitely recommend that there are much better salts available in the market now than Shelcal. Shelcal is the oldest one, but
Yeah, I know.
found that its
What
absorption
is
is
the
not
other?
so good.
What
Its
is the other?
absorption is, yeah, it's not so good in absorption, and we don't get
Ah,
much amount of calcium. So there are many other which are available like Dicalis,